Hi, this is Howard Lamplugh. I'm coming to you this evening for Shore Medical Center's Retiree Healthcare Plan Renewal. And we have a lot to talk about. And as a result of much higher rates this year, in 2026, the options that we are introducing will be significant changes that you need to know about. And that is what we will primarily be talking about this evening. Now, approximately a week ago, maybe 10 days, you received a letter from me that basically said, please send me your prescription drug lists. I asked for those lists because the biggest change that we're having this year deals with the Horizon Group prescription drug rates. And those rates have gone up dramatically. I found a way, I think, to help many of you reduce your costs. If we were just passing on the group Horizon prescription drug costs, your costs would go up significantly. We'll talk about that in detail in a few minutes. However, one of the options that is being provided this year is to allow you to switch into an individual prescription plan, which we will also spend a good deal of time talking about. But that list that I requested from each of you is important, because if I am going to be able to offer you a separate prescription plan, or if you can get that information from Medicare, and we'll talk about that soon too, that prescription list is absolutely necessary in order to consider or determine whether or not an individual prescription plan will be available for you at a lower price. So that list, that letter that I sent, is vitally important. And if you have not already sent it in, you need to get it into me or call Medicare, as we're going to review later, as an option. But in any event, if you do not have that prescription list for yourself, then you will have to stay in the group prescription plan through Horizon. That's always going to be an option. But again, it's going to be a higher cost option. So now I want to talk about, after that envelope and letter that I sent you, I'm going to go over in some detail the group renewal package that I sent to you in an envelope that looks just like this. Now, that envelope contained a great many pieces of paper and information. I'm going to go over those pieces with you individually, page by page. I'm going to go slow enough, I hope, that everyone can follow me, and I'm going to summarize some of it so that we don't have to cover every word. The first item that is in that package is a letter, looks like this, and it's from Vince Azzarello, who is the Vice President of Human Resources at SMC. In that letter, Vince describes that we are introducing 2 new options for the retiree healthcare plan. And the reason why we're doing that is because of much higher rates, hopefully that you may be able to avoid, again, by utilizing an individual prescription drug plan. Now, in this package that was sent to you, in this envelope, there is also a page that looks just like this. This is your 2026 authorization form. And on that form, your name is noted, and it says what coverage you have now in 2025, and if you keep that exact same plan, what will be the cost in 2026. I know some of you have already received it. In fact, most of you have. And it may be somewhat shocking to you relative to the increases. If that's the case, the whole purpose here is to go over how we may be able to defray some of those costs and utilize a little bit different option for you. You will note that, again, on this page, there are now 9 separate options. In the past, there were 4. So we've increased the number of options significantly. Back to Vince's letter. Vince said to you that we will be having 2 primary changes. One of them, the opportunity to elect an individual prescription drug plan in the state in which you live. Separately, you will also have the opportunity to take the Medicare supplement plan only. And you would be taking the Medicare supplement plan only when you choose to take an individual prescription drug plan. They kind of go hand in glove. That said, we're also introducing one more thing about Medicare supplement plans, and that is we're adding a new Plan N, like Nancy, to our mix of Medicare supplement options. In the past, for many, many years, we've had Medicare supplement Plan F, like Frank, and G, like George. Now we're going to have 3. We're going to have Plan F, Plan G, and Plan N. Plan N is also a lower cost plan. We're going to cover the details of that option later in the program. But at this point in time, I want to set down Vince's letter and give you the final detail of his last paragraph and say, I will be presenting the group insurance renewal meetings at Great Bay as we have in the past. These meetings will be held on Monday, November 10th and Tuesday, November 11th. I'll be there in the morning and have afternoon sessions as well. The morning sessions start at 9:30. The afternoon sessions start at 1 o'clock. Everybody's welcome, and I would really encourage everyone to attend this year if they can. Now, the purpose of this video is for those people that cannot attend, and we have a number of people who live out of state, and we don't expect them to jump on a plane and come to Great Bay. But the meetings will be held at Great Bay, as we always have, year after year. We're there again this year, and I would again encourage everyone to please attend those meetings. Now I'm going to put this letter from Vince down. I'm going to go back to the enrollment authorization form, and I'm going to talk about this form just a little bit. The form has a lot of numbers on it. What's most important is that you complete it and return it to me. Because if I don't get this form back from you, we will keep you in the existing plan that you have now in 2025. Meaning you'll just roll over to the next year in the same plan if we don't get a form back. I would hope that everyone would look at these rates and look at the options being presented to determine whether or not they can possibly reduce what would otherwise be a higher cost by using the Horizon prescription options that are our current group plan. If you have questions about this form, please give me a call at any point. Be patient if you're trying to reach me, because this is going to be one incredibly busy year given the changes that we're making. So I'm going to put that form down now, and I'm going to go into the details of the package information that I sent to you. The first page that I want to cover is, and it's similar to the authorization form, and that is this 2026 plan options sheet that talks about the plan options and their costs. And as you'll see, when you go down the left side, it basically tells you from option number 1 through option number 9 what are the costs for single or family coverage of each one of those options. I'm not going to go over each and every one of the options. I will point out to you that some of these options, for example, option number 3, option number 6, 7, 8, and 9, they're all new. And they're new because, again, we're introducing opportunities that were not provided in the past. And hopefully, as you look at that, you'll recognize that some of these new options are directed toward providing you lower costs. Now, I'm putting that page aside. First, I'm going to talk about the old group plan that we've had on a package basis for years. That plan, or plans, those options, will continue. In those program plans, the group plans, we have 2 prescription plans, and some of this may look familiar to you. There are 2 prescription plans. We use colors to kind of identify them back here at my office, but this plan, and the page I'm holding up, is the SMC Retiree Group Horizon RX plan, and in red it says on both corners, low option. This is the prescription plan that the vast majority of you have. The costs on this low option plan have gone up dramatically. And as a result, we feel that there may be a better way for you to choose your prescription plan coverage. Now, this plan, the low option plan, is most definitely still available. And from that perspective, it would remain a part of what I would label as a bundled package, meaning prescription drug plus the Medicare supplement plan. Having 2 parts, Medicare supplement and prescription drug, together with one price. That's available now, it has been in the past, and will continue to be available. The other prescription plan we have, some of you were in this, approximately 60, is the high option prescription plan. This prescription plan provides a little bit better benefit than the low option plan. It costs a little bit more to have it. In fact, I'd say, I won't say dramatically more, but more. And this will also continue to be available as an unbundled, as a bundled prescription plan with our Medicare supplement. And going forward, it's still here. You can still choose to have this combined with your Medicare supplement. And again, the rates for that high option prescription plan from Horizon, the group prescription plan, have gone up significantly. And moving on, I just talked about the group prescription plans. Now, combined with either one of those group prescription plans, the high option scripts or the low option scripts, there is a Medicare supplement plan. I'm holding up an outline of Medicare benefits that includes Medicare supplement coverage. And this should look familiar to all of you because I have handed it out every year now for as long as I can remember. All we do every year with this format is we update it for the changes that occur in the Medicare Part B deductible and other elements of Medicare Parts A and B. But this format is important because, in particular this year, we have added a Plan N. So we have Plan F, we have Plan G, and those 2 have been with us for many years, and now a new Plan N. This format, and I'll talk about it in some more detail later, is something that should be familiar to you. It takes you through and walks through the benefits of the Medicare or each of the Medicare supplement plans here in the middle. And out here on the far right, there are what we call UPay columns. The UPay columns essentially give you the information of what you get when you add Medicare with any one of the Medicare supplements. And the UPay column is a kind of cut to the chase. Tell me what I have to pay out of my pocket if I've got Medicare plus a supplement. And these UPay columns are, from my perspective, very valuable because they do cut to the chase. They tell you essentially what the benefits are for having Medicare plus a supplement. And most importantly, what do you have to pay out of your pocket? Now, I'm going to put that down and come back to it a little later, because in a later part of the program, we concentrate on the Medicare supplement. But the real star of the show tonight is the Medicare Part D coverage. And in your package, I provided everyone with a sheet that looks like this. Now, this sheet on the front says individual Part D plan options. Take your time to read this carefully, and the sheet of paper that's attached to it, because this essentially is what all of the information is about this year. The Medicare Part D plans from Horizon, as I've said many times already tonight, have increased rather dramatically. Many of you do not know this until this year, that there are state-based Part D individual prescription plans available. Those of you that are in the SMC prescription plan only know about the group plan because you're in the group. SMC provides you with a terrific retiree health care plan. It might be a surprise to you to find out that the vast majority of your friends and neighbors or relatives who are retired and have Medicare are not in a group plan. Group plans for retiree health are rare. And as a result, these individual Part D prescription plans are common among your friends, neighbors, and relatives, because that's how they get their prescription drug coverage through Medicare. We're just introducing it to you this year as an option because of the increases to the Horizon group. So we're going to look at individual plans as a potential option for each person. Here's the difficulty. If you want to look at an individual prescription option, you must have your prescription list, the drugs you take. I call it your prescription regimen. This includes prescriptions, not including vitamins, not including over-the-counter items that you might get, like cough syrup or aspirins, real prescriptions. You need to have that information in order to run a report through the Medicare Plan Finder system. I've been using it for years for people that are not a part of this group. And it's a very important and vital tool to identify which individual prescription plan is available for any given individual who may have 1 or 2 drugs or 10 or 12 or 15 drugs. And the variability of that prescription list is critical to determining what is the best available individual plan. Now, in this sheet, I tell everyone, because Horizon raised the rates, you're being given the opportunity to elect an individual plan. Many of the rates for the individual Part D plans are less expensive than the Horizon group. Okay, we've said that, talked it to death so far. Now it comes down to the detail of you getting your prescription list together, and you can send it to me, and I will do my very best to respond to you. Here comes the problem. I'm one person. There are 320 SMC retirees. I will never be able to get all of this done by the end of November. I just won't be able to humanly do it. So, one of the options you can pursue, and I'm counting on many of you to do this, get your prescription list together, and on this sheet, it tells you to call 1-800-MEDICARE. Why would you do that? Because the people who are working at Medicare, and by the way, Medicare is open 24 hours a day, 7 days a week. So there's no reason why you couldn't make a call. That Medicare number is 800-633-4227. You can call them, give them your prescription drug listing, and they will run the same report for you that I would. And they can give you all the answers that I would. And I would hope that some of you would take advantage of that because, as I said, I will never be able to respond to 300 people within less than 30 days at this point. What they do, what I would do, is take your prescription list, load that information into their computer program. You basically then press a button, and this wonderful program runs a report, and it gives you back a report that literally spins each one of the available individual Part D prescription plans in economic order. So it's like having this computer program that eliminates a week's worth of work if you were trying to do it across a conference table with paper. It's a marvelous invention. And I thank CMS every day this time of year for it being there. However, when you go to do this, if you call Medicare, you have to have your prescription list. And I want to go through these points. They're on this page, but I want to go through them. They're important for you to pursue this. You have to have your Medicare ID number. I promise you, when you call Medicare, they're going to ask you for it. So have it with you when you make the call. Secondly, you have to have a list of all your prescriptions. Try to make sure you spell them correctly, because someone at Medicare may ask you to please spell it. And some of the names of various pharmaceuticals are long and tedious with many syllables. So take your time, go slow, spell those drugs out, and you must know what the dosage and the frequency is as well. Meaning, I could say I take a atorvastatin, 10 milligrams, and I take it once per day. Good enough example. Some drugs you may take twice a day or once a week. Some drugs may be injectable. You have to know in detail so you can convey it, communicate it to someone at Medicare exactly what you're utilizing. Once you do that, they can run the report for you right there on the phone. It only takes a couple of minutes. Doesn't take long. It will take you a lot longer to tell them what prescriptions you use than it will for them to run the report. Something I want to make sure you understand, when you're doing this, they may ask you, are you a part of a group plan? And if they do, they may tell you that you have to go back to your employer and make sure that you can take an individual plan. And that's part of this program, is that when you leave the Sure Medical Plan prescription program, you cannot come back to it at a future date. Which means if you go to an individual plan, you're going to be staying in the individual prescription market going forward. I don't see that as a major issue. And the reason why I do not is because the group prescription market has diminished over the last 2 or 3 years. There are many fewer group insurance carriers, insurers, providing Group Part D prescription plans. There are many more individual plans out there to be considered. They're not the same as the group plan, and you have to recognize that. However, they are very similar in many ways. Look at this as an alternative. You don't necessarily have to use it, But again, given the cost of the increase on the Horizon side, this may very well be something you want to do. I've mentioned using Medicare, and I've also said that I will work on as many of these as I can. Be prepared that you may need to call Medicare to do this. They are trained and very capable to perform this work. All you have to do is tell them clearly what you want them to do. You're only looking for Part D individual prescription options. Tell them that when you call. Don't let them take you far afield to anything else. Focus on Medicare Part D individual options and tell them you'd like them to take your list of prescriptions and give you back the report information about what's the least costly plan for your script list. And they can give you that information, as well as they give you the name of the carrier. They can tell you who the second best plan is if you want to know. You can give them other forms of information. For instance, many of you may utilize Shore Medical Center as your pharmacy. Now, I'm going to advise you, the Shore Medical Center pharmacy is only included in 4 New Jersey-based individual plans. So what does that mean? That means if there are 10 options available, Shore Pharmacy is only in 4 of them. That means 6 of them. There's no Shore Pharmacy. But there are other pharmacies like CVS or Walgreens or ShopRite or Walmart or any number of other places where you can buy your prescriptions. So that may be something that's crucial to you, that Shore Medical Center's pharmacy is included. If that's the case, then you need to know that your options will be limited. In the package that I sent you, in addition to the page we were just talking about, which generally talks about the options, much more specifically, there is a page that is a very busy page, and it looks like this. Now, this page that I'm holding up is for the state of New Jersey. There is a different page for each and every state. So, New Jersey is different from Pennsylvania. New Jersey and Pennsylvania are both different from Virginia. And each and every state has its own list of individual prescription drug plans. In the package that I sent each one of you, there is a list for your state. So do me a favor and don't look or talk to one of your friends in a different state about their list, because they will be different. Now, this list does a couple of things that are important for you to recognize. We've talked about the cost of the prescription plans from Horizon. On this page, I'm giving you right here, about a third of the way down, the actual costs of the Horizon prescription plans, the low option and the high option. And you will note the prescription plan from Horizon for the group is $145.70 per month. The cost for the high option prescription from Horizon for the group is $160.80 per month. Those costs are almost, but not quite, twice as high as last year. Why did they go up so much? Generally speaking, the reason for the increase in almost all prescription rates this year deals with the increase in prescription benefits that everyone has gotten this year in 2025. You may recall last year, and if you don't, I'll remind you, Congress passed a law about 3 years ago, and it became effective this year. The maximum out-of-pocket expense under an individual prescription plan is now, in 2025, $2,000. That's the most you can spend for your share of the cost of all prescriptions for the year. That does not include the premium of the plan, just your share of the costs. Prior to this year, that $2,000 was $8,000. And a load of people who have Medicare have enjoyed the benefit of reducing that out-of-pocket cost from $8,000 to $2,000. Now, if you are one of those people who only takes 1 or 2 prescriptions and they're generics, it has no effect on you. But trust me, we have people in this group, and I have clients outside this group, who utilize $10, $15, $20, $50,000 worth of prescriptions. And if you looked at the cost of some prescriptions, you'd understand. That reduction from $8,000 out of pocket to $2,000 out of pocket is being absorbed by the insurance industry, by these Part D prescription carriers. And when the losses or the claims go up, the insurance industry raises rates. And that's what we're seeing. Horizon must have had a terrible claims year because of the rate increases they're passing on. Whether or not that's true or not, to me really doesn't matter. It is what it is, and it's a significant rate increase. Now, on this page, we move from the group Horizon renewal rates right here, and down below the lower half of this page, we list, in this case, 12 separate individual prescription plans. We give you the name of the plan and the monthly cost. These plans are not the same as the Horizon group plans. Most of these plans have a deductible. The Horizon plan has no deductible. Many of these plans will waive the deductible. Some will, some won't. They'll waive the deductible for generic drugs. But the point is that they are different. And that's why looking at your individual prescription list is crucial to determining whether or not any of these individual plans are a better option. Now, for many of you, it will be a better option. But when you look at this sheet and you see all these numbers, don't try to analyze it yourself. Allow me or someone from Medicare to give you some aid in doing that, because that's what the CMS computer plan finder system was developed for, so that not me, not you, so that not anyone has to do all the work themselves. So take advantage, if it works for you, of utilizing one of these plans. I'm going to give you a simple example, and it probably doesn't apply to a lot of you, but here's a simple example. If one of you had the low option Horizon prescription plan, and the cost of that is going to be $145.70 a month, and let's say, for sake of example, you take 2 or 3 generic prescriptions. For example, atorvastatin or lisinopril, or many people use levothyroxine, which is a thyroid medication. There are literally hundreds of generic drugs. If you use 2 or 3 generic drugs, you will more than likely fit into one of these top 2 or 3 individual options. The premiums of those options for the Humana Basic Plan, which is the least expensive in the state of New Jersey, is $4.40 per month. The WellCare Value Plan jumps up to $22.80. The WellCare Classic Plan is $28.20, and so on down the page. But if you would qualify for one of those lower cost plans, you would be saving more than $100 a month. That is significant. And again, it may not apply to you, but for many of you, it will. And the whole idea here is to get your prescription list, run it through the system, and see. And then you can decide whether you want to use the individual plan or continue to use what I call the bundled plan, which includes the Horizon prescription group option along with your Medicare supplement. Now, I'm going to take this page and I'm going to set it aside. When you have questions about it, you can call me, but my comment to you is always going to be, we won't know until we run the report based on your prescriptions as to what the answer is. It's the only way we can do it. So keep that in mind as you're looking at all these numbers. The most important ones to focus on are the premiums, not so much the copays, not so much the deductibles. Over here in this column on the far right-hand side, I've added a column that says whether the Shore Medical Center pharmacy is included or not. And there are 4 plans that have it. If that's very important for you, make note. But if you feel that you could get your prescriptions from a retail pharmacy, Walgreens, CVS, Walmart, ShopRite, Save-On, which is the Acme Market, all of those places are available amongst these individual plans. So I'm going to put that aside. Now, there is another piece of the program that we need to talk about, and that is the Medicare supplement. Excuse me. Looking at the option for choosing to go to a Medicare Part D individual plan, what does that mean? It means that you are opting out of the Shore group plan for that piece of your plan. Only prescriptions. You're opting out. And as I said before, if you opt out, you can't come back. But the bigger part of your Medicare package is not the prescription, and I know we're emphasizing it, we're spending all this time on it, but the bigger part, the most expensive part, is the Medicare supplement. Now, in your packages, there is another section, and I'm holding it up now. That section is the Medicare supplement only option. Now, if you take your prescription plan out of the group and go elsewhere to an individual plan, what's that leave? It leaves the Medicare supplement coverage. And we're giving you the opportunity to have Medicare supplement only coverage through SMC, assuming you go and buy an individual prescription plan. Now, a lot of people are going to ask this question or will be thinking it, so I'm going to address it right now. Every year, when SMC management sits down and determines what to do, they're using a budgeted amount of money directed toward these plans. And if I haven't talked about it a great deal before, this year I'm going to tell you so that everyone understands that we're being transparent about the costs that are being contributed by the hospital. So here it is. It's $200 per person per month is what the hospital is paying for your health insurance plan. That $200 a month is $2,400 a year. You get that as a single, and if you have a spouse, then it's 2 times $2,400. Each of you gets $2,400. That total will not change if you switch out and go to an individual prescription plan. what we are going to do is take the entire contribution of $200, apply it to the Medicare supplement, and you will find that if you take Medicare supplement only coverage through the Shore group plan, that the rates have gone down rather significantly, and that the new Plan F that we have added is also a much lower price than in the past. Now, keep in mind, if you go to this Medicare supplement only format and go outside and get your prescription drug plan somewhere else, all of the contribution will go towards your Medicare supplement plan, and you will have to pay for the costs of your prescription plan through that individual carrier. That cost for that individual prescription plan will be deducted from your Social Security check, or it can be billed to you at home. But it will not be paid for by Shore Medical Center because they're taking the entire $200 and allocating it toward your Medicare supplement to offset that cost. Hopefully that's clear. The Medicare supplement plans that we have available, again, for 2026 are three options, and they are in our total program: option 7, option 8, and option 9. And they are Medicare Plan F, Medicare Plan G, and Medicare Plan N. The Plan N is new, as I've said before. You do not have to change your Medicare supplement plan. If you like Plan F, you can keep it. If you like Plan G, you can keep that. And if you want to trade down to a little bit lower cost plan, and I'll cover the details of the differences in a minute, you can do that. Keep in mind that if you're taking this Medicare supplement only option, you must take an individual prescription plan from some other source. You cannot bail out of prescription drugs. And here's why. Because the federal regulations establish that if you do not elect a Medicare Part D plan, a prescription plan, then you get penalized in future years if you want to come back to Part D. And trust me, virtually all seniors will eventually someday need prescription drug coverage. I just don't know that many people that do not use prescriptions at all. The regulations, the law, basically says you must have a Part D plan. This whole scenario, or this whole objective here, is to look at other individual options. However, if you go to an individual prescription option, you'll take the Medicare supplement only. Basically, when you do that, you are unbundling the former group insurance program that's been provided to you for several years. Literally, we are unbundling the Medicare supplement from the prescription drug if you choose to do that. And again, it's your choice. And I'll say it again, you can stay in the bundled supplement plus group prescription plan through Horizon if you want. So now, this new Plan N. What is this new Plan N, and what's the difference between the old Plan F and the Plan G? On the first page of this outline, you will find there are no differences between Plan F, G, and N. No differences at all. And that front page, it addresses how each of those Medicare supplement plans, F, G, and N, how they coordinate and combine with Medicare Part A. And this is essentially inpatient care. It does not address outpatient care at all. And if you think about it, the vast majority of services you receive are outpatient. So now, we go to page 2, and herein lies the difference. On page 2, Plan F, the Plan F supplement, if you have that plan and it costs more than the other two G and N plans, Plan F basically says for outpatient services, you have 100%. You don't have to pay any Medicare Part B deductible, which next year is going to be $288. You don't have to pay that at all. So if you go to the doctor, Medicare will pay 80%. The supplement will pick up the 20%. There's no deductible. You've got 100%. A lot of people like that plan. A lot of people, well, about 60 people are in that plan out of our 300 plus. And I've tried to convince people to lower their costs, but they don't want to lower the cost. They want that plan. Great. It's the best option. So Medicare Supplement Plan F will remain available, and it is the best option. Also costs the most. Medicare Supplement Plan G, which we've had for years, costs a little less than Plan F, and that plan is virtually identical to Plan F, except when you use Plan G, you have to pay up front before you get any benefits. You have to pay the Medicare Part B deductible, which again, next year is going to be $288, and that's an increase from $257. $257 is 2025, and 2026 it'll be $288. But you know, after the $288 for the deductible, everything's paid for by Medicare, meaning after that $288, you've got 100% benefits. So we've had those plans for years. They're terrific benefits. Ask anybody who's had a lot of healthcare services. They'll tell you. Whether you've got Plan F or Plan G, they're both great. Now, what's Plan N? All right, so here's the new plan. Plan N says, it's very similar to Plan G, except Plan N says you have to pay the Part B deductible, which is $288, same as Plan G. But in addition, you have to pay out of your pocket, when you go to the doctor, $20 copay. So you'd have the $288 deductible, and after that's finished, if you go to the doctor, they can charge a $20 copay. And separately, if you go to the emergency room, there's a $50 copay. And which, by the way, a $50 copay at the emergency room is not much. But those two copays are new, and they are a part of the Plan N Medicare supplement. One final item for Plan N that could be an expense. It's rare, and I've only seen it once or twice in my career. About the time I say I've never seen it, it'll happen. But Plan N makes you responsible for any Medicare excess charges. Now, what's a Medicare excess charge? Medicare allows doctors to charge up to 15% more than what Medicare pays them for any given service. I'll make an example. Rounded numbers. Suppose you had major heart surgery and the cardiac surgeon was paid $10,000 for performing your surgery by Medicare. if you have Plan F or Plan G, if that doctor charges an excess over what Medicare pays him, and he's allowed to do that, by law, he's allowed to do it up to 15%. So if Medicare pays him $10,000 for performing the surgery, he can charge an excess as much as $1,500, which is 15% of $10,000. He's allowed to do that. Plan F and Plan G would cover that excess charge if it was made. Plan N does not cover it. It's an important point because an excess charge would then be your responsibility if it occurred. Point I would make is that it's pretty rare. There are some states that do not allow Medicare supplement, that do not allow the Medicare excess charges. I live in Pennsylvania. Pennsylvania is one of those states, but New Jersey is not. So if you live in New Jersey, the Medicare excess charge could occur. And that is something to be aware of as a part of the new option Plan N. Aside from Pennsylvania, there are some other states that, Ohio being one, there are some other states that also do not allow the excess charges, and most of them are in the Northeast. So Ohio, Pennsylvania, and then you start going up toward New England, New York, Rhode Island, Connecticut, Massachusetts, Vermont. I think that's all. In total, I think there are 8 states that do not allow it. I could look that up, but we don't have time to do that. The point being is that the majority of the states do allow it. The majority of the states in which SMC participants live allow it. And if you're looking at the details of Medicare Supplement Plan N, you should be aware of that if you're considering changing to Medicare Supplement Plan N. That's all there is relative to the changes in that Medicare Supplement Plan N. This is a 4-page format. Many of you will see it and recognize it because we've handed it out year after year after year. And frankly, if you were to combine that Medicare supplement and Medicare outline with the 2 prescription drug plan, the red and the blue, these 2 options, if you were combining them with that 4-page outline, that was the material that was presented to you year over year until now. And I'll repeat that that plan is still available if you want to keep the combined Medicare supplement and prescription from Horizon in the group plan. If you don't want to do that, you can choose to go out and get your individual prescription plan. I think, in fact I know, that the individual prescription market is larger and more vital than the group market. I am in, my wife is in, almost all the people you know are in individual Part D prescription plans. Keep in mind that your Horizon prescription group plan is, put it in terms of a car, a Cadillac or a Mercedes or even a Rolls-Royce. Because the prescription, the high option prescription plan from Horizon is an analogy of Rolls-Royce. It's a great plan, but it costs a lot. And to the extent that you may not need all of that, here's the opportunity to trade down and still get the prescription coverage you need and not have to pay for a lot of excess. So with all that said, I invite any of you to send me your prescription list, and I will do my very best to respond to you. Again, going back and saying, I'm one person. You can get the people from Medicare who are trained and ready and capable, because I've tested it. They're ready and able to help you. And you may be able to do that a whole lot quicker than using Howard Lamplugh. Now, I know all of you folks out there, and I do want to be the one that helps you. But under the circumstances and the time limits that we've got, I just won't be able to do it. So I want to encourage you to utilize the Medicare format option and get back to me and tell me how it went. And one more really important point is that if you use the individual Part D option and you call Medicare, make certain that you make a note of what plan you joined, because I'll need to know. If you go and join a Medicare individual Part D plan and you enroll through Medicare, that means that I'm going to be billing you for just Medicare supplement coverage. So in order to bill you properly, I will have to know what prescription drug plan you're going to use. So you're going to have to help coordinate with me if you take that step to go to Medicare. But many of you will need to do that because I won't be able to respond to everyone. So we're going to sign off now. I hope that this helps everyone. For those of you that don't have the chance to come to the group insurance meetings, again, on the 10th and 11th at Great Bay Country Club, hopefully this video has helped you. And feel free to call. I'm going to be in my office the whole month, so look forward to hearing from all of you and what you think of these options. Take care and God bless.